Respected judges and delegates, a very good afternoon to all. My topic for today's presentation is Ophthalmic Manifestations of Mucormycosis, a prospective study. Mucormycosis refers to a rare, severe opportunistic infection with fungi of the order Mucorales. Mucorales have an intrinsic ability to invade the blood vessels and can evade the different parts of the body. Cerebro-rhino-orbital mucormycosis is the most common and the most aggressive form. Uncontrolled metabolic conditions, especially diabetes mellitus, is the main risk factor. Mucormycosis is a rare fungal infection and the incidence in India is much higher. Affected individuals may have poorly controlled diabetes, metabolic acidosis, or immunocompromised. Mortality remains high despite advances in diagnosis and treatment. We have studied 11 cases of mucormycosis, out of which 8 had orbital findings. Detailed history taking ophthalmic examinations were done. A visual acuity slit lump examination, intraocular pressure measurement, contrast enhanced CT scan, MRI orbit was done. Associated systemic examinations were also done. Temperature measurement at regular interval, urine examination and blood sugar test was done and the results were analyzed. The ophthalmic presenting features were lid edema was present in 8 cases, chemosis, periorbital edema, facial edema and discoloration of the lid, discoloration of face was present in 4 cases, proptosis in 6 cases and ptosis in 3 cases. Ocular motility restriction was one of the common presenting feature, 6 cases, and ocular pain was present in 6 cases. Associated systemic features were COVID-19 history was present in all the 11 cases. Uncontrolled diabetes mellitus in 5 cases and controlled diabetes mellitus in 3 cases. Malignancy was not associated in our study and poor general condition was found in 1 case and hypertension in 3 cases. To record the visual acuity, more than 6/24 visual acuity was found in 6 cases, 6/24 to 3 meters in 6 cases and PL negative in 4 cases. This is one of the case of mucormycosis. The patient was seriously, the patient which had low general condition and much lid edema and proptosis, chemosis, gross restriction of ocular movement was there. This patient actually succumbed to the general condition. Now about the management of the cases, retroorbital amphotericin B was given 3.5 milligram per ml in 6 cases. Liposomal amphotericin B was given. Pre-medication of injection Avil and paracetamol was given. First dose 1 ml containing 1 milligram without pre-medication. Hypersensitivity reaction was watched for 30 minutes and then 1 ml of retroorbital injection containing 3.5 milligram of amphotericin B was given. Posaconazole tablets were given 300 milligram 2 times on day 1 and 300 milligrams OD on day 2 onwards to all the cases. Exentration of orbit was done. Entire eyeball and the surrounding structures including muscles, fat, nerves, eyelids were removed. Dressing of the orbital cavity was done frequently. Skin grafting was given and posaconazole tablet 300 milligrams twice a day to start and then 300 milligrams OD were continued. This is a case of mucormycosis presented with restriction of ocular movements and ocular pain. Patient was COVID positive 3 months back. Following 3 months of COVID, the patient became COVID negative. After that, the symptoms started. CT scan of the orbit revealed orbital mucormycosis. These are the restriction of ocular movement and mild proptosis was there. Only on CT scan, it was diagnosed to be mucormycosis. Following exentration, this is the photograph following exentration of the orbit. The nasal cavity and because it started, the patient first presented to the ENT department where the debridement of the sinuses were done, and then exentration of the orbit was done, which was life saving. So exentration of the orbit was done and debridement of the sinuses. So it took a combination of ENT surgeon and ophthalmic surgeons. To conclude, rhino-orbital cerebral mucormycosis is a severe opportunistic infection. The destructive exentration is life-saving. Retroorbital amphotericin B and posaconazole tablet is also helpful. Thank you.
Thank you. You did not mention about the paranasal sinuses which are
Yes,
affected in all
actually
this.
to start with, it was a paranasal sinuses. The patient presented to ENT department to start with, and then they gave us a call
I
that to see
understand
the
that,
orbit.
but in your presentation, none of the slides showed involvement of the paranasal sinuses.
Yeah,
That
yeah.
is what I want to point out. The number two is the terminology of destructive exentration is not good. You can say radical exentration rather than
Okay.
destructive. It is not
Okay.
destructive.
It's
It is life saving,
life
right?
saving. Yes.